So, like instead of the few essays which are repeated, I'm thinking that I will replace the question with knee joint. It's a very important essay question. So, knee joint is the largest and most complicated joint in the body, and it is most superficial joint, and it is hinge type of synovial joint. You need not read all these things. Just look at the articulating things what we have. The bones which we have are lower end of the femur, the superior aspect of the tibia, and the patella. Lower end of the femur and the superior surface of the tibia and patella. These are the three bones which are taking part in the formation of knee joint. Remember, fibula is not taking part in the formation of knee joint. Okay. So now the type of joint is, it is condylar and it is modified hinge joint. What do you mean by hinge joint? Like hinge, what you see in the door. Usually the door like hinge is allowing the movement only in one direction. Similarly, in the knee also we find direction only in one side. That's the reason it is called as hinge joint. Okay. So the primary movements what we see in the knee joint are flexion and extension. Some rotation is possible. Yesterday we did shoulder joint. I told you it is highly flexible. Circumduction is possible. Such movements are not possible here. Okay. So transverse axis is also not fixed. It moves forward during extension and backwards during flexion. Okay. So I told you what are the three bones the knee joint is made up of: lower end of the femur, upper end of the tibia, and patella, kneecap. We know patella is a sesamoid bone which is formed in the tendon of which muscle? Quadriceps femoris. In the front of the thigh, we have four muscles which are together called as quadriceps femoris. Isn't it? What are those muscles? Vastus medialis, vastus intermedius, and vastus lateralis, rectus femoris. Those four muscles together, they form a tendon which gets inserted into tibial tuberosity. So within the tendon of quadriceps femoris, we have patella bone. Patella itself is a 3 marks question. It is a sesamoid bone developed in the tendon. You see here, I told you fibula is not directly involved in the joint. Okay. Now the combination of three primitive joint cavities are, there is a joint. Now see, this is the medial aspect of the picture, and this is the lateral. How did we identify? Because tibia is medial bone and fibula is lateral bone. Then so the superior surface of the tibia and inferior surface of the fibula, they are forming certain connections. You call it as like first you see between the femur, like this is the inferior aspect of the femur which is covered with the articular cartilage, correspondingly is articulating with the we have same articular surface of the patella. The name of the joint here is femoropatellar. Femur and patella, femoropatellar. On the medial side, we have medial condylar, and lateral side, we have lateral condylar. So, medial condylar joint is between medial condyle of the femur and medial condyle of the tibia. This is the medial condyle of femur, and this is the medial condyle of the tibia, superior side. Lateral condylar joint is between lateral condyle of the femur and lateral condyle of the tibia. Okay. Then we have patellofemoral. Patellofemoral in the sense between the patella and the femur, we have patellofemoral joint. Now, the stability of the joint is depending on the various things like the strength and action of surrounding muscles. The first thing, the surrounding muscle I said is quadriceps femoris, isn't it? Then we have various ligaments which will be elaborating now, which is connecting tibia and femur. Now we are going to see all these ligaments in detail. First, I am giving you the list of ligaments. We have like any other joint, we have like outermost covering at the margins of the articular surfaces, we have capsular ligament, we have ligamentum patellae, we have tibial and fibular collateral ligament, anterior and posterior cruciate ligaments, medial and lateral menisci. These are the major ligaments. Apart from that, we have secondary ligaments like oblique popliteal ligament, arcuate popliteal ligament, transverse ligament, and coronary ligament. Let us elaborate each and everything. Knee joint is an essay question. It comes for 15 marks usually. Though it sounds difficult, but I will try to make it very simple. See here, capsular ligament. Don't read anything. I'll try to make you understand. See, this is the inferior aspect of the lower end of the femur, where we have the medial and lateral condyles. So just above those condyles, you will see this green line is indicating the attachment of capsule. And we know these are the superior condyles of the tibia. The margins of this condylar area is giving attachment to the capsule. Okay. So so overall capsule is a fibrous sac. That means capsule is covering the margins of the articulating bone superiorly and inferiorly. So whole thing you have all surrounding, you will have capsule. So that is a thin fibrous sac which surrounds the joint, but there are certain areas where the capsule is open. Like in the shoulder joint also, I told you there is a gap for the passage of which tendon, which I told you yesterday. We have seen long head of biceps brachiae was passing. Similarly, this capsule is also deficient in some places, like above the condyles anteriorly, where it is giving passage to suprapatellar bursa. What is the meaning of bursa? Bursa is nothing but extension of synovial membrane filled with synovial fluid. Basically, all fibrous capsules will have interior lining. That interior lining is nothing but synovial membrane. So wherever friction is more, obviously knee joint is the most important joint which is exposed to lot of friction when we are kneeling down, or when we are taking support on the ground, or when we are sitting down. So many works which where the knee joint is directly exposed to the friction. So for which we see there is an opening in the fibrous capsule for the passage of the synovial membrane, and you will have oil filled bag. In simple words, that oil filled bag is nothing but bursa, which is filled with like synovial fluid. Synovial fluid is like oil only. Then so this passage is for suprapatellar bursa. Then behind lateral condyle of tibia, you see here even the capsule is not complete here. The gap is shown here. The line, green line is not continuous. That means what here we have passage for the tendon of popliteus muscle. This I told you when we were discussing popliteus origin insertion also, isn't it? Okay. So now this muscles, complete muscles, whatever you are finding, these are the quadriceps femoris muscle. Okay, and this whole thing is fibrous capsule. Okay, in the anterior aspect of the fibrous capsule, you will see there will be a small opening for suprapatellar bursa like this, and in the posterior aspect of the capsule, we will have a small opening for the passage of popliteus tendon muscle. Okay, now the overall, the fibrous capsule will have certain structures which are strengthening. Like for example, I told you when we were discussing shoulder joint, I told you the rotator cuff muscles are just getting flattened. The tendons of all these muscles, they get flattened before they take insertion on the greater and lesser tubercle of the humerus. That means those supraspinatus sits muscles, infraspinatus, teres minor, and subscapularis. Similarly, we have structures which are surrounding the capsule and giving strength. So what are those various structures we have? From posterior aspect, we have oblique popliteal ligament. Medially, we have tibial collateral ligament. Everything I will show you. Anteromedially, we have medial patellar retinaculum. Anterolaterally, we have lateral patellar retinaculum and iliotibial tract. Okay, now. So now we are elaborating on capsule only. So that is the femoral attachment. Lot of information is given here. You need not discuss in such a great detail. List of all ligaments is very important, and you just like above the femoral condyles on the femur all around you will see the attachment of capsule. You can write in that way also. And along the margins of the tibial condyles we will see the attachment of capsule. That is more than enough. But here little more information is given which is actually maybe confusing for you. Femoral attachment. Now see here, upper border of the intercondylar notch, then adjoining articular margins of medial and lateral condyles. This green line beta. Okay. Then laterals, like it is moving like 1 centimeters above on the medial condyle and also 1 centimeter above on the lateral condyle. Okay. There is a passage for the opening of the popliteus tendon. So tibial attachment, I told you it is all along the margins of the tibial condyles. That sentence is enough, okay, but posteriorly it is deficient for the passage of the tendon of popliteus. These are the words which are enough when you write your answers. Okay, synovial membrane. Where do we see? I told you, suppose this is the capsule. Inside of the capsule will have a membrane. This membrane is nothing but synovial membrane. It lines the capsule except posteriorly. Okay, so there, what is the purpose of synovial membrane? It is the a membrane which secretes the synovial fluid, which is nothing but oil which is seen in the joint cavity. Okay, so synovial membrane lines the capsule except posteriorly where it is forwarding by cruciate layer. This I will show you. In front also it is absent because there you will see suprapatellar bursa is there, above which patella is present. Okay, uh, whatever is present, that is more important beta. Now see here, I'll show you. See this brown lining what you have outside is the fibrous capsule. Okay, this brown outline. So lining inside the brown outline, there is one more line which is shown. So that will be nothing but the synovial membrane, and this fluid is shown in brown color, that is nothing but the synovial fluid. Okay, now there are extensions of synovial membrane which they actually form bursae. Like we have prepatellar bursa. In front of patella we use the word prepatellar bursa. Above patella we use the word suprapatellar bursa. Below patella bone we use the word infrapatellar bursae. Okay, and of course fat is also seen. Now if you see, this is the lower end of the femur and this is the upper end of the tibia. Between them you are finding the articular disc also, like fibrocartilaginous rim we are finding. Okay, so now I told you ligamentum patellae. What is this? It is derived from the tendon of quadriceps femoris. That is front of the thigh. We have four muscles. That is quadriceps femoris. So that quadriceps femoris tendon is taking insertion on tibial tuberosity. This is tibial tuberosity. On its way, because it is exerted to lot of friction and work. Okay, during the milestones itself, when the baby is crawling, standing, taking support, walking, you will see, because this tendon is exerted to lot of pressure and friction, a bone is formed within this tendon which is called as patella. Okay, so ligamentum patellae is one of the ligaments of the knee joint. First you have to start your information with ligamentum patellae, which is derived from the tendon of quadriceps femoris, from the apex of the patella to the upper part of the tibial tuberosity. Okay, so this ligamentum patellae you can feel in your own body also. It is very much subcutaneous, and deep infrapatellar bursae lies close to its lower end. Okay, just now I have shown you, this is the infrapatellar bursa. Okay, this is our ligamentum patellae, this is the tibial tuberosity. In front and behind you are finding these green bags filled with oil, which are nothing but infrapatellar bursae, which lie close to the lower end of the ligamentum patellae, also called as patellar ligament. When knee joint is locked, all ligaments are tight, taut, except ligamentum patellae. Okay, that is just. Now see here, beta, you are finding all these quadriceps femoris muscles. Front of the thigh, if the question is asked, you are supposed to write the origin, insertion, nerve supply action of these muscles. What are those? We have vastus medialis, vastus lateralis, rectus femoris. Below this we have vastus intermedius. Okay, all four muscles. If you lift this muscle, you will see vastus intermedius. They form the ligamentum patellae. Here you have a sesamoid bone, that is patella. Okay, you can see the retinaculae. That means you are finding there is a triangular like expansion on medial side, this is the lateral side, and medial side of the patellar ligament, which are called as medial retinacula and lateral retinacula. Okay. So iliotibial tract we will see on the lateral aspect of the thigh. So that iliotibial tract's band is also coming and joining the surface of the capsule of the knee joint. Okay. Whatever is visible here, I'm trying to make you understand. Now, the second ligament, after ligamentum patellae, the second ligament we have is tibial collateral ligament, also called as medial collateral ligament. Okay, don't read anything here. With the help of this picture only, you try to understand. So, this is the medial view of the knee joint where we are finding this is the medial condyle. Okay, the most prominent part of medial condyle is called medial epicondyle. So from the medial epicondyle, you can see the ligament is moving to the capsule of the knee joint, and it is also moving on the medial condyle of the tibia. Medial epicondyle of the femur, medial condyle of the tibia. That means it is actually splitting into two slips. Okay, one is moving anteriorly and the other is moving posteriorly. Tibial collateral, that means from the femur bone to the tibia bone, like that you try to remember, you call it as tibial collateral ligament. The thickening of the structure on the medial aspect of the capsule of knee joint, you call it as medial collateral ligament. Because medial bone is tibia, you call also as tibial collateral ligament. Okay, so it is representing a detached part of adductor magnus. Adductor magnus we will see in two compartments of the thigh, medial compartment and also posterior compartment of the thigh. Okay, so it is strong, long, thick and flat band of fibrous tissue. It has superficial and deep parts. Just remember, extending from medial epicondyle of the femur to the medial condyle of the tibia. These words are enough. Okay. Now coming to the fibular collateral ligament. See, fibular collateral ligament is extending from lateral condyle of the femur, to be more specific, lateral epicondyle of the femur to the head of the fibula. Okay, this extension you call as fibular collateral ligament, also called as lateral collateral ligament. I told you, like on the lateral compartment of leg, we have two muscles, peroneus longus and peroneus brevis. So this ligament is actually derived as a primitive origin from peroneus longus muscle. Okay. Then now in this picture, what are we are finding two ligaments. From the tibia, you can see this is the tibial collateral ligament and this is the fibular collateral ligament. Okay, outermost covering will be the fibrous capsule. Now, lower end of the femur, upper end of the tibia, you are finding there is a fibrocartilage which is sitting between two bones. This fibrocartilaginous structure between the two bones is actually called as meniscus. On medial side, you call it as medial meniscus. On lateral side, you call it as lateral meniscus. Now, connecting the inferior aspect of the femur and tibia, you are finding there are some oblique ligaments. What are those? We have anterior cruciate ligament and posterior cruciate ligaments. So these ligaments also we will elaborate now. Very, very important. So the oblique popliteal ligament, you see this is in oblique direction, it looks like this. Okay, so it is an expansion for the tendon of semimembranosus. This semimembranosus muscle comes from the posterior compartment of the thigh. We will study one day all the compartment muscles instead of one sum question if the questions are repeated. Okay. So semimembranosus expansion, like from the insertion, this is the insertion of semimembranosus. It is getting expanded and it forms the oblique popliteal ligament, which is extending from the posterior surface of the medial condyle of the tibia to the lateral part of the intercondylar line of the femur. This is the medial condyle of the tibia bone. From here to the femur, you write like that. From the medial condyle of the tibia to the posterior aspect of the femur, you will have oblique popliteal ligament, which is an expansion of the tendon of semimembranosus. Okay. So this is oblique popliteal ligament. Here also you can see oblique popliteal ligament. Next we have arcuate ligament. The arcuate ligament, which is shown in green color here, it is Y-shaped. Okay, the stem is attached to the, this is fibula bone. This is the styloid process of the head of the fibula where the stem is attached, and it has anterior band and it has posterior band. Okay, so which are actually, the posterior band is attached to the lateral condyle of the tibia, you can see here. Okay, and the anterior band is attached to the lateral condyle of the femur. So this is arcuate ligament, Y-shaped band what we have. Then the cruciate ligaments, you see you have X-shaped crisscross ligaments connecting the inferior aspect of the femur and superior aspect of the tibia. So from the anterior aspect, when you see, you call it as anterior cruciate ligament. From behind, when you see, you call it as posterior cruciate ligament. So we have anterior and posterior cruciate ligaments. They are found within the capsule, okay, but extra synovial. So they look like letter X, hence they are called as cruciate. Okay. So if they are taking anterior attachments, they are called as anterior cruciate ligaments. If they are taking posterior attachments, you call them as posterior cruciate ligaments. Now let us see the attachments. These are important, but we cannot skip. Anterior and posterior cruciate ligaments are heart of knee joint. So we need to read it very carefully. No, anterior cruciate ligament attachments. See, this is the superior aspect of the tibia bone. This is okay, and on the superior aspect of the tibia, this is the medial condyle and this is the lateral condyle. Okay, on the superior surface of the medial condyle of the tibia, we have a fibrocartilage called as medial meniscus, and the superior aspect of the lateral condyle of the tibia, again we have a fibrocartilage called as lateral meniscus. Okay, then this is the intercondylar area of the superior surface of tibia. This is all tibia. On the intercondylar area, you are finding anterior cruciate ligament attachment, posterior cruciate ligament attachment. Let us see. The anterior cruciate ligament, below it is attached to this anterior part of intercondylar area. That means it comes like this beta. This bone is completely tibia. These are the superior condylar areas of the tibia, and this is our anterior cruciate ligament, which is coming from anterior part of the intercondylar area, and it is going to the like lateral condyle of the femur. See the direction, it is going like this. It is going to the lateral condyle of the femur, but on the medial side. That's why you see here, above it is attached to the medial surface of the lateral condyle of the femur. It moves like this. Okay. Even if you can't write medial surface, you just write it is moving from the anterior intercondylar area of the tibia to the lateral condyle. You have anterior cruciate ligament. Okay. Then what does it do? It prevents hyperextension. It prevents forward displacement of tibial condyles. It acts as a vertical axis for rotation of femur. Then we have posterior cruciate ligament. So posterior, obviously it is coming from the posterior part of the intercondylar area of the tibia, and you see it is moving towards the medial condyle. Okay, it is moving towards medial condyle, but the lateral surface of the medial condyle. This is medial condyle because fibula is shown very clearly. Okay, so this becomes medial surface of medial condyle. This becomes lateral surface of medial condyle. So posterior cruciate ligament is coming from the posterior aspect of the intercondylar area, and it is attached to the lateral surface of the medial condyle of the femur. Okay. Now the function is it prevents side to side displacement of femur and tibia, and it prevents backward displacement of tibial condyles. Now, so we have coronary ligaments also, which are like this. They are covering part of fibrous capsule only. You can just skip coronary, nobody will ask. But transverse ligaments are very simple and easy to remember. See here I told you, on the superior aspect of the tibia, on the condyles, we have medial meniscus, fibrocartilage, lateral meniscus. Like for shoulder joint, yesterday we have seen glenoid cavity, we have glenoidal labrum. Materialized fibrocartilage. Here also menisci are made up of fibrocartilage. These fibrocartilaginous structures are connected anteriorly. This is tibial tuberosity, no? Hence this is anterior connection between medial and lateral meniscus. You call it as transverse ligament. Okay, they just connect medial and lateral meniscus. You just remember in that way. Okay, so meniscofemoral ligament, we can just menisci are very very important. But so I will tell you menisci by looking at the pictures only. So these pictures are very good. What we have already seen, previous ones were good. See here, this is, but you should not get confused. Like wherever you see the tibial tuberosity, that is the anterior aspect. Beta, look for tibial tuberosity. So this is medial meniscus. This is lateral meniscus. So this is anterior horn. This is posterior horn of medial meniscus. Similarly, this is anterior horn of lateral meniscus. This is posterior horn of lateral meniscus. Okay, the menisci are present on the lateral aspect of the condyles. Okay, now, whichever are important, see menisci, these are semilunar cartilages. They are crescent, means half moon shaped, which are present between the joints, between the two bones, between the tibia and between the femur bone. Between the two bones, you are finding them as intra-articular discs, which are made up of fibrocartilage. Their border is quite thick, whereas they are very much thick towards the periphery and thin towards the inner border. Okay, so that is also clearly visible in this picture only. They look thicker towards the margin, isn't it? And they look thinner towards the interior side. Inner side is thin, outer side is quite thick. Okay, so few points whichever are easy we will try to discuss better. So medial meniscus. See, which is the medial meniscus here? Whichever is big, large condyle is the medial side. So this is the medial meniscus. We know it has anterior horn. Towards tibial tuberosity is the anterior aspect. This is anterior horn and this is the posterior horn. So medial meniscus, write few points whichever are easy for you. This is nearly half moon shaped or semilunar. It is longer antero-posteriorly if you measure like this. Presents anterior horn which is shown in green color, posterior horn which is shown in blue color for us. Anterior horn looks narrow, posterior horn looks wide, isn't it? Then upper surface is concave. When you look in the dissected specimen in the dissection hall, so this area is concave, whereas lower surface is flat, which is resting on the condyles of tibia. So medial margin is this, which is convex, okay, and attached to the capsular ligament, and lateral margin is concave and free. Okay. Coming to the lateral meniscus. So lateral meniscus is something like 4/5 of a circle it is. Okay. So it also has two horns like anterior horns and posterior horns. Both horns are of almost equal width irrespective of medial meniscus. Okay. So the posterior horn is giving attachment to meniscofemoral ligaments. These 2 points you remember beta, like very simple things like same point, upper surface is convex, lower surface is flat, you can write same thing like medial margin is concave and free, lateral margin is convex, and it is attached to fibrous capsule. Okay, so what is the function of these menisci? What is the purpose of this medial and lateral meniscus? Sometimes menisci itself may be asked as a short note. It increases stability by deepening the tibial plateaus. Okay, that means tibia is deepened because of the presence of this menisci. They decrease friction also by 20%. They increase contact area by 70%. They act as shock absorber to protect articular cartilages during weight transmission and locomotion. Peripheral area will have, see, anastomosis around knee joint will be giving blood supply from outside. Hence, peripheral area will receive more blood supply. Okay, when you compare with the central area, which is comparatively inner free part is avascular and it is receiving its nutrition from the synovial fluid which is filling this area. Okay, now coming to the one, we are done with the ligaments of knee joint. We will now see, this is Vishram Singh's picture. Draw this picture, you can write in your own words. Front is this anterior, this is posterior. We have posterolateral, posteromedial, whatever structures are given. So in the anterior, we have ligamentum patellae, prepatellar bursa. In the posterior, we have oblique popliteal ligament, popliteal vessels, and tibial nerve. And posterolaterally, we have tendon of biceps femoris, common peroneal, plantaris, lateral head of gastrocnemius. Posteromedial, we have semitendinosus, then gracilis, semimembranosus, okay, medial head of gastrocnemius. All this, draw this picture, practice this, put all these things in your own words. You need not write whatever is given in the slide, you put in your own words, that is also fine. Once you are done with the relations, we have bursae. So bursae, I told you, these are nothing but the synovial membranes filled with synovial fluid. Wherever we have lot of friction, we have bursae. So just below the skin, you have subcutaneous prepatellar bursa. Okay, right in front of the knee joint, just below the skin, between the skin and anterior surface of patella. Subcutaneous infrapatellar is this one, skin and tubercle of tibia. Deep infrapatellar bursa is this one, which is little deep to this tibial collateral ligament. Sorry, patellar ligament. Then suprapatellar is this, above the patella bone. Okay. So, but behind the quadriceps femoris tendon. So housemaid's bursa. So swollen subcutaneous prepatellar bursa in housemaid's due to, like, this is the posture which is usually taken by the housemaids, isn't it? That's the reason we find this may get infected and frequently there may be inflammation which is leading to bursitis, prepatellar bursitis, which is also called as housemaid's knee. Question may be framed in this way also, housemaid and all. So you have to identify it as knee joint. Swollen subcutaneous prepatellar bursa in housemaids due to washing of floor by adopting kneel down position. Okay. So clergyman is a person who is giving speech in the church, isn't it? So they, like, this is the posture which is occupied by them. So there also you will see